We are excited to continue our collaboration with the American Red Cross and the Medical University of South Carolina. The Circle of Hope campaign aims to raise awareness about sickle cell disease and the urgent need for blood donations. Each month, we feature live interviews, news segments, and community blood drives to educate you about the support that's needed for people with sickle cell disease. And there is encouraging news today for sickle cell disease patients and their families. 2 new gene therapies are available for some patients. The therapy is working for Ashanti Pickens, the youngest person in South Carolina to receive a treatment designed to cure sickle cell disease. She is feeling stronger and already looking years down the road at how she can someday help children whose childhood is redefined by a disorder, a disability, or a disease. You can't miss the maturity when listening to Ashanti Pickens talking about receiving the cure for sickle cell disease.
Well, today I'm here because I just recently got the cure for sickle cell, which is gene therapy sickle cell cure. Every Monday I've been here so far getting checkups, come to make sure my counts are good and labs are good. And everything is doing what it's supposed to be doing.
The reigning 2024 National American Miss South Carolina preteen is wise for her years.
I'm 13 years old.
Ashanti does not have to look far to see the face of someone who is also battling sickle cell disease.
Me and my brother, we both had sickle cell.
Her brother, 15-year-old Dontrell, underwent a bone marrow transplant at the Medical University of South Carolina in 2023.
With having sickle cell, you can't do most things that normal kids do. But ever since I got the gene therapy sickle cell cure, that kind of changed my life. And now I can do what other kids are doing.
Sickle cell disease racked her body with pain when she suffered a crisis, but so did the curative treatment.
I came in to actually get the cure around January. I was in the hospital for maybe 2 months, and I had to go through chemo first. After that, I started getting mouth sores, and I actually stopped talking for a while because the mouth sores was just too much, and it was hurting really bad. And getting mouth sores, they actually went down my throat, and it was kind of scary, but I did go through that.
Tony Yates is Ashanti and Dontrell's mother.
It's not a disease that tells you when it's going to attack.
She has been navigating life with 2 children who have this diagnosis.
So just the disease itself has been probably the most challenging, trying to navigate through their health care. They've been blessed with really good doctors. Sometimes it was challenging whenever, never know when sickle cell is going to go. You can't really get to their hematologist. There would be times where I have to take them to the hospital, and I would know more about sickle cell than some of the doctors. And then with Ashanti, we were going to go with a half match for her too, because she didn't have a bone marrow donor on the registry. But she was a better candidate for the gene therapy. So that's why we went with gene therapy. She met all qualifications.
Dr. Jennifer Jurasic is Ashanti's doctor.
Other than bone marrow transplant, there were no other curative or transformative options.
Dr. Jurasic says up until about 2023, the treatments made life with sickle cell disease more tolerable, but did not end the crises or cure the disease.
In December of 2023, there were 2 FDA-approved gene therapy treatments, which instead of using cells from somebody else, genetically modify the patient's own stem cells, and then we give those genetically modified stem cells back. So it is still a very long, intensive process, but the intensity of the follow-up after treatment is shorter. Patients can often return to school or work 60 to 90 days after they've had their infusion, where with bone marrow transplant, it could be 6 to 9 months.
And the cure has consequences. The gene product has to be created, and it can cost $2 to $3 million for just a tablespoon of it. And chemotherapy can cause infertility. Yates has a simple message to families who have a child with sickle cell disease.
Advocate, ask questions. If you feel like something's right, follow your instinct. 9 times out of 10, something isn't right. Pray, keep your faith, listen to your healthcare providers. Really be there for them. It can get really dark.
And now back to the patient with a passion for pageants.
I just want to complete my pageant journey.
And her sights are also set on helping children who might be on a similar journey.
Go to high school, do high school, and then go to college and become a pediatric nurse or doctor.
We're behind you 100%, Ashanti. If you would like to find out more about participating or sponsoring the Circle of Hope campaign and gala that happens October 1st at the International African American Museum, go to lowcountryredcross.org. Stay with us.